Thank you for allowing me to weigh in. This has been an outstanding committee meeting. I'm very pleased that we were discussing such an essential topic at this point. Quite frankly, the response to the COVID-19 pandemic has not been adequate for our tribal nations, our communities of color, and basically across America. For our tribal nations, of which I represent the Navajo and the White Mountain Apache out in Arizona's 1st Congressional District, up until very recently, Navajo Nation had the highest per capita COVID-19 infection rate in the nation. This was just surpassed by the White Mountain Apache, also in my district. White Mountain Apache currently have over 1,300 cases of COVID-19 out of an enrollment of just 12,000 people. This is a small tribe that is, I just talked to the chairwoman this morning. It was just sad to have that discussion. But the common thread amongst many of these communities of color, tribal nations, it's the deserts. It's the healthcare that's in those communities. It's the food, the health, the infrastructure, the housing, all of those deserts that are out there. I'm looking out at a desert right now, but I'm close to a store. I'm close to healthcare. I have banks around the area. These areas don't have that. I grew up on the west side of Chicago, and Representative Kelly and Representative Rush know that well. And I have to tell you, I'm just in shock. And we have bills to make sure we get some epidemiology information for tribes, but it has to go so much further to address the critical issues of racial segregation, racial impacts, and the lack of this Congress and this country to acknowledge that we have trust and tribal obligations and treaty obligations. This pandemic has exposed what those of us who live in rural and underserved America already know. We lack access to healthcare providers. It is estimated that over 100,000 homes on tribal lands lack access to running water and adequate sanitation infrastructure. On Navajo, roughly 30% of the population lacks access to running water at all. I introduced a bipartisan bill to address this very issue here, and I hope to see it move in a future House package. Before the COVID, the unemployment rates across the district, Navajo was at 40 to 50% unemployment before COVID, and the White Mountain Apache was close to 80% unemployment. Dr. Boyd, thank you for noting in your testimony that Native Americans are 19 times more likely to have access to clean drinking water than white Americans. Now, I also want to ask you a question. Do you believe that better reporting and information sharing of illness in minority communities can inform better the treatments and improve health outcomes and create better policies? Specifically, how can we do this to ensure that we can identify issues and allow them to be addressed in a culturally appropriate manner with federal support when and where it is needed? Thank you.
Yes, just to bring up the clean water example that you brought up, which is so devastating for Indigenous communities, that's not a function of what we don't know. We already know that residential segregation onto reservations and that public divestment in the Indian Health Service has left so many Indigenous communities without the resources they need, including basic resources like clean water. We don't need further data to say we need to further invest in Indigenous communities and their healthcare infrastructure to further address what their needs are. Um, Obviously, though, data is really important, and I'll only underscore one more point, which is that Indigenous communities are often left out. If they aren't counted as other, they aren't counted as all because their populations are often very small, which is again a function of genocide in this country. So we also have to be committed to counting at smaller rates who's affected and how, so that we make sure we always encompass what's happening with Indigenous communities.
Thank you, Doctor. Dr. Brooks, in your testimony, you mentioned implicit that bias training is necessary for physicians and all healthcare professionals. I believe it is also implicit for the Congress of the United States. When patients are subjected to biased treatment from their healthcare provider, how does that impact their decisions to seek care in the future? And does it also contribute to poor racial and tribal health care outcomes?
Yes, if a person feels that they have suffered from implicit bias and therefore poor care, they're maybe less likely to go seek care the next time. So, and that can happen with the Native American population, certainly. So that's why it is critically important to have implicit bias training, because then we can, that's just one hurdle that we can get past and now get to the more mundane treating illness.
Thank you, Madam Chair, and I yield.